Welcome, everyone, to today's episode of The Healthy Christian Lifestyle. Today, we're going to be talking about vitamin D. Vitamin D is a powerhouse of the immune system, one of my favorite vitamins. Now, before I get any further, let me just remind you not to change anything in your medication, your exercise, or your dietary routine without consulting your own medical provider. I'm just providing you with this information so that you can make informed decisions along with them regarding your health. Now, vitamin D, we usually think of in terms of bone growth, perhaps muscle growth, but in actuality, it really is a powerhouse of the immune system. It can actually inhibit the proliferation of cancer cells as well as slow down their rate of progression. And this is particularly true of colon cancer and rectal cancer. Proper levels actually decrease cancer rates. And in males, proper levels actually decrease their overall risk of mortality. Now, there are certain things that can interfere with your vitamin D levels, such as artificial sugars like Splenda. There are medications that you may be taking that interfere with your vitamin D levels, steroids or statins, or even diuretics such as hydrochlorothiazide. In these cases, as well as if you're someone who has to wear clothing that covers your body all the way down to your ankles, or covers your face, if you have a darker complexion, if you are have had gut surgery, or if you have certain chronic conditions, these can affect your vitamin D levels. So that you would need to get your vitamin D level checked and then be placed on proper amounts of vitamin D per your medical provider. But vitamin D is so important. It's so important. When it comes to viral infections, vitamin D can decrease the chances of severe effects of a virus, such as respiratory distress syndrome. It decreases the risk of severe symptoms from COVID-19. In fact, a low level of vitamin D has been associated with more hospitalizations and more deaths from COVID-19. Vitamin D also is involved in insulin resistance. It decreases your insulin resistance and so contributes to blood sugar regulation as well. There are other instances in which you definitely need supplements. A breastfed child would need to be supplemented with vitamin D. And that would be until the child is weaned or is at least on a liter of vitamin D fortified formula. What you want to do is get outdoors and walk in the sun. Now, not at peak times. This is very important. Do not walk outside without any protection from the sun at peak hours. That's too much. But what you need is just a simple 30-minute walk when there's some sun outside, non-peak hours, where your face, your arms, your legs are exposed to the sun. What this does is allow the vitamin D that you're getting in your diet to be converted to the active form of vitamin D that your body needs. Now, where do you get vitamin D from your diet? Well, you can get it from mushrooms, fatty fishes, the liver oils from fish, and of course from fortified products that are fortified with vitamin D. Now, I really want you to understand how important this is. So please have your vitamin D level checked. Having proper vitamin D levels decreases overall mortality. And there are studies showing a connection between having your vitamin D level and zinc and quercetin and these types of things during COVID-19 infections being very helpful in decreasing severity of disease and hospitalizations. And those studies are underway now. So that being said, get out there and walk, get some sunshine, and be blessed. God bless you.